Mesothelioma is a type of cancer that develops from the mesothelium, which is a protective lining that covers many of the internal organs of the body. The mesothelium lines the lungs, chest wall, abdomen, and heart. There are three main types of mesothelioma based on where it originates: pleural mesothelioma, tumors in the lining of the lungs; peritoneal mesothelioma, tumors in the lining of the abdomen; and pericardial mesothelioma, tumors in the lining around the heart. Mesothelioma is considered an asbestos-related cancer, as exposure to asbestos fibers is the main risk factor for developing this disease. Asbestos was commonly used as an insulating material in buildings until its usage was banned or restricted in most of the industrialized world from the 1970s-1990s. Working with or near asbestos materials puts one at high risk of exposure through inhalation of dust particles containing asbestos fibers. This includes workers in shipbuilding, construction, firefighting, mining, insulation, and manufacturing industries where asbestos was used. Family members of asbestos workers also have a slightly elevated risk if they are exposed to asbestos dust brought home on work clothing. While asbestos exposure is by far the biggest risk factor for mesothelioma, it is estimated that only 5 to 10% of those exposed will eventually develop mesothelioma. The risk increases the more asbestos exposure one has, as well as the longer that exposure lasted. Other potential minor risk factors include radiation exposure and infection with the SV40 virus. However, the role of these secondary risk factors is controversial and still under scientific investigation. For most patients, the cause of their mesothelioma can be clearly linked to occupational or environmental asbestos exposure earlier in life. The mesothelium cells lining membranes around the lungs, heart, abdomen, or tunica vaginalis testis can be damaged and changed by asbestos fibers. It usually takes 20 to 50 years after asbestos exposure for mesothelioma cancer to develop. Once the DNA of the mesothelial cells is damaged, they start proliferating uncontrollably and forming tumors. These tumors can cause thickening and scarring of membranes, filling up pulmonary cavities, and compressing and invading surrounding anatomical structures. Common symptoms of mesothelioma depend on the location of the tumors. Pleural mesothelioma symptoms include chest pain, shortness of breath, cough, wheezing, and fatigue. Peritoneal mesothelioma symptoms include abdominal pain or swelling, bowel obstruction, unintended weight loss, nausea, vomiting, and fatigue. Some patients may experience constitutional B symptoms like fever, night sweats, and weight loss as well. Later stage disease can cause fluid buildup around the lungs or abdomen, causing shortness of breath or swelling. Diagnosing mesothelioma can be challenging, as symptoms are often nonspecific. Common tests used include chest X-rays, CT scans of the chest or abdomen, and MRI to visualize potential tumor growth. Tissue biopsies obtained by thoracentesis, tapping chest fluid, laparoscopy, viewing inside abdomen with a camera, or video-assisted thoracic surgery, VATS, small incision lung biopsies, are typically done. Pathological examination of biopsy tissue samples under a microscope by a pathologist is needed for a definitive diagnosis of mesothelioma. Immunohistochemical staining of the biopsied cells for markers like calretinin, WT1, D240 and cytokeratins help differentiate mesothelioma from other cancers that may look similar, like lung adenocarcinoma. Staging of mesothelioma involves medical imaging tests like CT scans to evaluate the extent of spread in the chest, abdomen, or elsewhere. The T and M staging system is used, where T describes tumor size and involvement of structures, N describes nodal metastasis, and M describes any distant metastasis. According to this system, mesothelioma can be staged from I to IV. Stage I means the cancer is localized to one side of the chest or abdomen only, while stage IV is an advanced or metastatic cancer spread to distant structures outside the organ of origin. Prognosis mainly depends on the stage at diagnosis, with long-term survival possible for early-stage disease, but stage IV disease being largely incurable with current therapies. Treatment options for mesothelioma depend on the stage, tumor location, overall health and preferences of the patient. For early-stage disease, extrapleural pneumonectomy, EPP, surgery to remove the entire lung, lining, and nearby structures may offer a chance for cure for select patients. However, this major operation carries significant risks. For most patients, the disease is too widespread at diagnosis for surgical cure. In that case, chemotherapy, radiation therapy or immunotherapy drugs may help control symptoms and extend life. Newer targeted therapies and immunotherapies are also being investigated in clinical trials. Radiation therapy may play a role for symptom relief or palliation. Participating in a clinical trial should also be considered if possible. Care of the whole patient involves relief of pain, nutritional support, and help with psychological or spiritual matters as well. With current therapies, the average survival time for patients with advanced mesothelioma remains 12 to 18 months from diagnosis. However, new treatments continuing to be developed deliver hope for improved outcomes in the future. Mesothelioma is an aggressive cancer directly related to asbestos exposure, with pleural and peritoneal subtypes being most common. It typically develops many years after asbestos exposure and causes symptoms related to chest pain and discomfort or abdominal problems depending on location. Definitive diagnosis requires visual examination and testing of biopsied tissue samples. Staging helps determine prognosis and guides multidisciplinary therapy options including surgery, chemotherapy, radiation, and investigational therapies. While a difficult disease, continued research brings hope for better screening, earlier detection, and more effective mesothelioma treatments in the years to come. Improving public awareness of asbestos risks and disease symptoms also remains important to expedite diagnosis and maximize chances for successful treatment outcomes.